Healthcare is a really tough business, and it's a very difficult and challenging service. I think that people who are in healthcare are in it for a vocation and not just a job. And to see some of the situations that people work in and the circumstances that they work in, and how much they can make out of those conditions is really inspiring. We had a wonderful car ride from Kathmandu. It was really a last-minute plan, and sometimes the things that are last-minute and least planned work out the best. But the roadways were pretty rough, steep, lots of winding, narrow roads on the sides of mountains, beautiful scenery. We were able to take 200 clean birth kits there as part of our Global Health Charities program. Meeting the hospital staff, delivering the clean birth kits, learning a little bit about what they went through, seeing the tents that are still on the location and how they had to clear the land that was covered with brush and trees. And one of our focuses there is on maternal and infant mortality, and the clean birth kits is really one of the signature programs that we are engaged in because of infant mortality. And there's so many women that just can't access clinics. I believe that right now the estimate is in rural Nepal, 20% of women birth at a healthcare facility, and the rest are at home or attended by a traditional birth attendant. It was especially meaningful to me personally because I grew up in Asia and had the opportunity to make this trip with some high school friends of mine who are also working on this initiative with us, and work with Sandy Pine from Community Partners International, who also went to school with us in Bangkok, Thailand. And so the collaboration side of what we do at GHSN is really critical, and the opportunity to collaborate with people I know and have grown up with and have similar interests and similar missions made it especially meaningful. Yangon via Doha and Bangkok, which was interesting because that's a common starting point for all of us who went to high school there together. And then up to Mandalay, and then from Mandalay we flew up to Mint Kina in Kachin State. So it was a tremendous trip to try and get these kits that really started out, on conference room tables and in classrooms with people putting them together. And to get them into the hands directly of the traditional birth attendants was extremely meaningful. And know that these are people who told us for the last 8 months they haven't had any birth kits. And so they've been helping to deliver babies in complicated situations where hospitals are 6 days away and their women are riding on the back of oxen to try to get to health care. None of these are simple cases, and giving them these kits means that 2 lives can be saved, a mom and a baby. And the impact on the entire family if mom dies and doesn't make it is tremendous too. So there's a ripple effect on the entire family unit. It's not easy to get to these places, and for us it was a challenge, and we had transportation, we had plans, we had arrangements, and that all was facilitated by great people like Sandy Pine at Community Partners International. These people are there and they don't have access, and they've got to be carried down mountains. One situation that Sandy told us about was a woman who was in labor for 2 days, and they had to carry her, 4 men had to carry her down the mountain, and then from there they had to put her on the back of an oxen and get her to another point where she could eventually be driven to the hospital. So it was several days, and it was just a huge privilege for us to be able to go there and to see also all the hard work and all the donations that were made by people back home got into the hands of these folks who were so extremely grateful for it. Knowing that these birth kits can help save a mom's life and save a baby's life is tremendous for us. And for me, what is so meaningful about this work is that we're all trying to provide better health care, regardless of where we are. It's a basic human need, and people are at their most vulnerable when they're sick or when they have a family member who's sick, and they're trying to get care for that family member. And anywhere you are in the world, that basic need is the same. I think the hardest thing about this trip was hearing some of the stories that the traditional birth attendants shared. And two particular cases that they shared with us. One was a mom who needed a C-section and was in a remote community and couldn't get to a hospital, and they didn't even have a knife to cut her open with. And they eventually found one and were able to cut her open and deliver the baby, but then they realized they had no way to suture her back up. Another case was a story about a mother who was delivering, and the baby's arm came out first, and they had no way of turning the baby. This was a situation where the birth attendant asked desperately for more training because she had been in the situation and didn't know how to deal with it. And the baby's arm came out first, and she didn't know how to turn the baby, and they had a horrific set of circumstances where they had to cut the baby to try to save the mom. They need the help, they need the resources, they need the training, and there's some wonderful groups out there helping, and we're just very proud to be able to support that effort. It's not always a complicated answer, it's not always a complicated solution, it really is simple things. For these reduction of infant and maternal mortality, it comes down to a clean razor and a clean plastic birthing sheet. So they're very simple solutions, it's not a lot of money, and it saves lives.